details, but we know the CARES Act will provide money that goes to Hawaii residents in the form of direct payments. Individuals may receive up to $1,200 plus $500 per child under 17. It also provides increased unemployment benefits of up to $600 per week for up to 4 months. This is in addition to the current benefits provided by the state. This weekend, I met with representatives from the business community to understand exactly how COVID-19 is impacting them and their members, both large and small businesses across the state. With businesses having to reduce their workforce, limit services, or even shut their doors, many are facing the reality that they have to close and may never reopen again. As I've said before, protecting the health and safety of Hawaii's people is my overriding priority. It is more important than ever to continue to practice social distancing. We cannot let down. We must keep our guard up. Getting through this crisis is going to take everyone working together. It will be hard, and it will continue to get worse before it gets better. But together, we are strong. Together, we will persevere. And I have witnessed the sacrifices that many of you are making in our community for the good of the state. And I'm proud of your efforts and courage, your commitment to help each other. Please take care of yourself, take care of your family, and help take care of each other. And we will make it through this pandemic crisis. Thank you.
Thank you, Governor. Our next speaker, U.S. Senator Brian Schatz, who joins us by phone now. Senator, are you there?
Thank you. Yes, I'm here. Can you hear me?
Yes, we can.
Thank you, Jody, and thank you to Governor Ige. The first thing I want to say is to
use
thank
his federal screen.
Every citizen across the state who's doing their part. People who are social distancing, people who are buying groceries for grandma and grandpa, giving to a nonprofit. If you're a frontline healthcare worker or a first responder or a small business trying to figure out how you're going to save as many jobs as possible, to every worker that's suffering economically, we know it's hard and we thank you. We are going to get through this together, but it is going to require an extraordinary, historic effort on the part of every single person in Hawaii. And we all understand that the more strictly that we can adhere to social distancing, the fewer people will get sick and die, and the quicker we can get through this. And we in the government need to bear in mind that the sacrifice being made by the average person is pretty nearly unimaginable just a couple of months ago. And so our obligation is to work together, to work efficiently, and to recognize that people across the state are going to need more financial assistance, and a government and a society that moves at the speed of this virus. So we do have a bit of good news to report. The federal funds coming to Hawaii will be a minimum of $4 billion. These monies are for COVID response in terms of allowing people to survive economically and also attacking and mitigating the virus itself. The details are in a document that we sent out to the media and are already public, but I'd like to go over the major components of that $4 billion. The first is a $1.25 billion transfer from the United States Treasury to state and county government. We will get $1.25 billion there. Secondly, the rough estimate of the direct payments to individuals that we anticipate people in Hawaii getting is about $1.243 billion. Finally, a very low estimate of the federal funds coming for the expanded unemployment insurance program is $1.142 billion. Additionally, we are looking at $130 million for the SNAP program, $53 million for the Department of Education, and tens of millions of dollars for other social services. What that $4 billion does not include is the small business program that is being ramped up as we speak, and the local banks are ready to roll. The local SBA is ready to roll, but we did not put a number on that because it really depends on our ability to execute loans and the participation rate. And finally, the part of the federal revenue that is also not included is that there is a $100 billion hospital fund nationally, and our hospitals, clinics, and nursing homes will be eligible to draw down additional resources. So the $4 billion is a quite conservative estimate, but it is good news in terms of the people and the institutions that need a lot of help. One final thing, I'd like to direct everybody to shots.senate.gov. My staff, since the passage of the CARES Act, has been working literally day and night to summarize each and every aspect of the bill, from what its implications are for the VA to renters and homeowners, to small business people, to family leave, and everything in between. And so the easiest way to understand how this bill can impact you or your business or your institution is to start at shots.senate.gov. Thanks very much.
Thank you, Senator, and stay on the line in case someone has a question for you a little later. Our next speaker is U.S. Representative Ed Case.
Thank you, Governor. Senator Schatz. The first and foremost thing I want to do is to embrace their comments, to say thank you to each and all of you throughout our state for your forbearance, for your understanding, for your contributions. They couldn't have said it any better. It's going to take us all to get through this, and we all are going to get through this. Our goal here in government is to articulate a plan, to explain that plan to you, to answer your questions, and to persevere through that plan together. In doing so, we not only help each other, but we avoid uncertainty, and we provide guidance, and we provide a path to where we all want to get back to. I want to thank the governor especially for including our congressional delegation. It's absolutely critical that your delegation of 4 of us in Washington, D.C. stay in very close contact and coordination with everybody back home to maximize federal assistance, target to Hawaii's needs, and gets folks the help and the answers that you need. And I know that I speak for Senator Schatz and the delegation in appreciating your full partnership. Senator Schatz has gone through many of the details, and I want to amplify some of those details in terms of what is in the CARES package, which, as Governor Ige noted, is the largest single emergency bill in the history of our country, as well it should be, considering the magnitude of what we face. It is the third of 3 bills that we have passed in Congress inside of this month. And I want to give you some of the macro figures. First of all, $2.2 trillion is the total price tag, including, as Brian said, at least $4 billion to Hawaii, of which there are other areas that we haven't even calculated yet, so it's at least $4 billion. Major areas are about $500 billion nationally to our industries, targeted to keep employees on the job. These are not simply handouts to companies and businesses. These are assistance that is designed to keep employees on the job, whether you're able to go to work or not. We want payrolls to continue across our country. Brian mentioned the $377 billion in assistance to small businesses, and that is businesses of less than 500 employees under the traditional definition. But this also includes people that were not particularly included in small business programs traditionally, such as independent contractors, sole practitioners, nonprofits, gig economy, drivers, taxi drivers. These folks, you are eligible for small business assistance. That includes $350 billion in paycheck protection. The goal there is to have our small businesses get loans in which to keep people on the payroll. These loans are forgivable if people are kept on the payroll or brought back onto the payroll. And as Senator Schatz has pointed out, the gateway to those are the Small Business Administration and our local banks who are going to be administering those loans. We also have $290 billion in direct payments to families. We have $260 billion to supplement unemployment insurance to take the maximum period up to 39 weeks and to supplement it with $600 of federal funds. As Senator Schatz noted, $150 billion to state and local governments, which they can target to their needs, with a minimum of $1.25 billion to Hawaii itself. $126 billion to hospitals and healthcare workers. We all know the crying need out there right now for PPE, personal protective equipment across our country. We're trying to help with that. There are other specifics here: education, vaccine, infrastructure. There's a lot in this bill, and our job is to make sure that we maximize these resources to the benefit of our Hawaii. As Senator Schatz pointed out, this is not the last bill that your Congress is going to pass. We really see this in three phases, what we're having to deal with here today. Phase one is survival. That's where we are right now. Phase two is stability, and phase three is recovery. And in the bills we've passed so far, we're trying to get through survival and to stability. A recovery package will come later on. In fact, we're already working on it in Congress right now. It'll probably include a substantial investment in our nation's infrastructure, which in many, many ways has been falling down. And so more on that later. I want to briefly answer a few of the more common questions that I get in my office. And by the way, like Senator Schatz, please go to case.house.gov, where I also have a full set of resources for you to go to try to get your questions answered, to figure out a way to contact me with your very specific questions. My staff also is completely on the job in both D.C. and Honolulu, and we are working very hard to get those questions answered, get that assistance out. First of all, on the direct payments. In general, please, we still are working out these details, but in general, if you have a Social Security number, you are eligible for those payments. The IRS said this morning that it'll take about 3 weeks for those to start to go. I'm sorry, that's slower than they said a week ago, and we all believe that these need to find their ways to you as soon as humanly possible. But that's what the IRS said today, so that's the timing. Now, for most people, especially folks that have filed tax returns in the last few years, you don't have to do anything further. That's the gateway to get you the payments that will be coming under that direct payment program. However, I also want to note, so that nobody is surprised, that these payments do start to phase down from their maximums of $1,200 per person, $2,400 per joint family, $500 per child under 17. They start to phase down at $75,000 individual income, $150,000 joint, and they phase out pretty much after $100,000, $200,000. We're, of course, trying to get that direct payment to the folks that especially need it to tide themselves through. Small business. There are a number of different loan programs under small business. There is an emergency loan program that has already been in place for a couple of weeks. And there is also the new program under the CARES Act, which again provides incredible loan opportunities to small businesses to keep people on the payroll, forgivable if in fact you do that. Those details are coming out right now. I want to acknowledge that in both cases, obviously, the small business and the direct payment, some of these sites have been overwhelmed, and we're trying very hard to the federal government to make sure that those gates are open for you to seek that assistance. Unemployment insurance, I've been working with the state very hard to make sure that people can get their unemployment insurance as fast as possible. I would conclude, as Brian did, by simply saying that we're on the job here full-time to help you, to work with the state, the counties, the nonprofit community, and many, many others who are in this fight. We're all in this fight together. And my contact, again, is case.house.gov. Mahalo.
Thank you, Representative. Our next speaker is Lieutenant Governor Josh Green.
Side? Yes. Okay. Well, aloha, everybody. The governor has given me a good marker allocation in my budget, so we are going to dig into some details today. Thank you, Gov. No, I'm very grateful to be here. Thank you, and it's terrific to be able to give an update on the health considerations of what we're facing today. So I'm going to allude to some of the points here. I hope people can see them. Now, the governor made an excellent decision that will save many, many lives, and you can see that over there on the 26th. That is the 26th of this month. That's that purple line that went up, where he asked us all to shelter in place and brought the hammer down on flights that were otherwise infecting our people, coming back infected. That is going to save lives because it's going to definitely decrease the curve, the height of the curve of people that are getting infected. If you look at these numbers, and I know it may be challenging for a moment, we'll try to flash over there. You will see that on the 26th, we had 95 cases. the 27th to 120, the 28th, 151, the 29th, 175, and today 204 cases, of which 6 of those individuals are in the intensive care unit. If we do a very good job, per the recommendations of Congressman Case, of Senator Schatz, of the governor, who has been very smart to decrease travel into our state, we will see this red curve, which is the projected number of tests, and that's about if we're perfect. If we are not perfect, in our ability to social distance and to stay at home, you will see a curve that looks like this purple line up above. That is if people ignore the home quarantine. And I want to show you something important. This is how fast it goes bad for us, how fast it goes bad. If people don't listen, it will go up, and there will be 8% more cases in 2 days. 4 days later, you will see a 15% gap, 15% more cases. And then on the 6th day, if we continue to avoid good advice from the governor, you could see 43% more cases. And those 43% more cases represent hundreds of people that will test positive for COVID-19, and they themselves will spread. That is how we lose. That's how people die in the state of Hawaii. That's why the governor was so smart to ensure that we stay at home. And that's why we should listen to General Hara when he says, please, please, please follow the rules, quarantine at home. Now, I want to go over some of the other key issues here. Capacity in our state. Also on this board is the number of beds we have. We have 2,757 beds available to us statewide, licensed hospital beds. We have 338 ICU beds. We have 534 ventilators available. Now, this is important information because if you see how fast this can go up, if we ignore the governor and the general's advice to quarantine at home, home isolate, we outstrip our capacity to care for people. There's good news. As of right now, and I'm going to point it over my once again, we are using only 37% of our ICU beds. That's very good news because that gives us some capacity to care for people if we get a surge. We're using 58 out of our 534 ventilators right now. 58, that's just 11%. That means we are keeping it down. However, if we do not quarantine at home, those numbers go up very fast. And just 400 or 500 people needing a ventilator will exceed our capacity to keep people alive. Now that brings us to something else important. The extraordinary work of engineers like our governor. We have already begun work here at UH, leading the country, working with technical experts, engineers in California, New York, across the country, to look at some ways to expand our ventilator capacity. There's already work to potentially make each of our ventilators capable of splitting into 4 ventilators. Now, this technology is happening very fast. It's happening with graduate students and PhDs across the country. This is the kind of thing that could rescue places like New York, who are in deep trouble, and us if we ignore Governor Ige and General Hara and people go out and spread this disease. Do not do that. But there are other technologies too. We're preparing a special kind of mask that's like a CPAP machine that provides oxygen for people in a dense. We're experimenting on that in Italy. There's another device that we're working on which gives compressions to provide air into people's lungs if we're in crisis and we have 2 beds. All of these technologies are happening in real time. We're capable of beating this. The last thing I would say is that the general is working very hard to make sure if we see a terrible surge towards the end of April or into May, if we see that terrible surge, we may have capacity to expand very significantly our number of beds. And that was mentioned by a governor at the last press conference. So we're looking at all the options, perhaps 100 or 300 or even more beds to help take care of our sick. But let me be clear. The very best thing you can do in the state of Hawaii as a citizen to save the lives of our kupuna is to please stay at home and listen to what the governor asked us to do through April 30th. Only go out when you absolutely need to, because if our curve flattens like you're seeing, we will not outreach and outstrip our capacity to take care of people on ventilators. We will be able to get out of this alive. I want to say once again, thank you very much There's a lot of data there, I know, but I wanted to make sure people knew that we were working on the testing side. We can test now up to 1,500 people a day. We've now tested third highest rate in the nation, and we're beginning to approximate South Korea. We're looking at technology to save lives, and we will expand our healthcare capacity as needed. You've heard about the bigger picture long-term on economics. We're very lucky to have the excellent congressional delegation we have. Keep the faith. Please listen to the governor and stay home till the 30th, and we'll get through this. Take care.
Thank you, Lieutenant Governor. Next speaker, Tim Sakahara, Public Information Officer, Department of Transportation.
Thank you, Governor. Thank you, distinguished speakers, and thank you, everybody out in the community. Historically, the month of March is very high in terms of air travel with spring break. Last year at this time, there were more than 33,000 people a day who were flying into the state of Hawaii. This year, however, those numbers are down more than 95% compared to last year. Now, just yesterday, the arrival numbers are as follows. There were 325 returning residents to Hawaii with a Hawaii ID, 167 visitors, and 34 intended residents. Now, the visitor category does not necessarily mean they're people into effect last Thursday. Now, those people are required to go straight from the airport to their home or place of lodging. They are not able to stop off at the grocery store, Costco, or the food club on the way in between. Now, after last week's news conference, we were notified of an organization that is helping in this case. Not only will they home deliver for Kupuna, but they will also pick up groceries or supplies for those people in quarantine so they don't have to break this order. So they can order their groceries online and then have it delivered to their either home or their place of lodging. There's various companies that are stepping up in this time of need to create a service like this. The one that I mentioned is called Hawaii Help is on the Way. Its website is hihelpisontheway.org, and they're one of the new services that are able to help these people in quarantine or any kupuna out there in the community in need. In closing, I would also like just to say that these are extraordinary times, and people in the airport managers and the airport staff are going well beyond their typical role in making sure this quarantine plan is implemented properly and effectively. So we send out a big thank you to everybody who's making that happen. In addition to all the additional agencies, the airport is only one component of the quarantine plan. There are many other agencies, including the Governor's Office, General Hara, the Hawaii Tourism Authority, the Hawaii Visitors and Convention Bureau, the hotel industry, the airlines, the Airline Committee of Hawaii, and of course the counties as well have been very active in making sure all this works, including all the law enforcement agencies across the state who have been diligently enforcing the quarantine and the stay-at-home efforts. So a big mahalo to everybody involved. Thank you.
Thanks so much, Tim. And Bruce Anderson, Director of the Department of Health, is our final speaker.
Aloha. The Department of Health received 29 reports of positive results of COVID-19 today. One of the cases was a child, and the rest are all adults. Of the 22 residents in the state, 7 are pending further investigation. But of those 22, 15 are from Honolulu, 2 from the Big Island, and 5 from Maui County. None from Hawaii. Incidentally, there are no cases to date on Lanai or Molokai. When I speak about Maui County, I'm speaking about the island of Maui. So there are 204 presumptive or confirmed cases to date in the state, and the vast majority of those are Hawaii residents. 165 of the 204 are Hawaii residents, 19 are visitors. Our surveillance program is ongoing. To date, we've collected over 254 samples. These are individuals who have flu-like illness but do not have the flu, and none of them have shown any positive results. However, having said that, in the samples we've seen over the last few days, we've seen 29 on Saturday, 26 on Sunday, and again today, 29 again. We're seeing some sign of localized community transmission. We have continued to investigate aggressively all the cases reported and their contacts. In fact, we are recruiting volunteers, students from the University of Hawaii and others to help with those investigations. Most of the cases we're hearing about now are being reported through private clinical laboratories. To date, there have been more than 8,700 laboratory tests conducted for COVID-19 samples in Hawaii. As Lieutenant Governor mentioned, we're, I think, third in the country now for actually having tested, and I think our testing program is actually more targeted than many states are. So I'm pretty comfortable that we're not seeing widespread community transmission. Nevertheless, this is certainly the time to act. With the recent travel quarantine requirements, we have a chance to lower the curve. We essentially eliminated the cases that we've seen associated with travel. And now it's really a question of us focusing on social distancing. It's okay to go out for a walk, take your dog for a walk, go jogging, go surfing, but do so individually and honor those social distancing requirements. That's the best thing, the only thing we're going to be able to do to lower the curve and stop the spread of the disease in Hawaii. Thank you very much.
Thank you very much, Director. You might want to stay there. We have our first question. This is a time for question and answer. Our first question is from the Associated Press. Audrey McAvoy asks Dr. Anderson, how many of Hawaii's 204 positive cases are travel related, and how many are the result of community spread as far as you know?
The vast majority of cases up till about a week ago were travel related. These are individuals who had traveled from other places where COVID-19 was widespread or came into contact with a traveler. Recently, we've had more cases where there is no travel history, and we don't know of any contacts the individual might have had associated with the travel. I believe that the travel-related cases accounted for at least 80% of the cases we've had until late. Many of these cases are still under investigation, so I hesitate to give you an exact number on that. But clearly, we're moving away from travel-related cases and focusing much more now on cases which are locally transmitted.
And while you're there, from Sandy Oshiro, HPR, she asks, how is the state planning for healthcare workers who will be lost to the workforce because of sickness or deaths because of the coronavirus, and what are the numbers expected to be lost over what time frame?
Well, we recognize healthcare workers, those on the front lines, are at increased risk of disease. In fact, we've prioritized testing for any who are symptomatic, so we should be able to identify those who have COVID-19 very quickly. Those and the first responders are on the top of our list for testing. And in fact, the State Health Department will be doing the tests on those where we can get a 3-hour turnaround. We're, of course, wanting to be sure that anyone on the front line is trained, has protective equipment, and the risk is reduced as much as possible to those individuals. They're critical for us in preventing further spread of this disease.
This is from Kristen Concilio, Star Advertiser. She says, you mentioned the DOH is creating maps of where localized transmission is occurring. When will you be able to tell the public specifically where the virus is spreading in the community? We
have begun the process now of determining what epidemiologic features are important, including case maps. The epidemic curve is being generated. And in fact, we have some preliminary data to show people where we're seeing cases occurring throughout the state. These are maps based on the cases we've seen to date by census tract, and we have it now pretty well tabulated for the state. We're also seeing in the epidemic curve that you keep hearing about, the flattening of the curve. We're at the very beginning of that curve as we see it, but we're starting to see the trend I mentioned, that we're moving away from travel-associated cases to more cases where there is no travel, where we're probably going to be seeing community spread.
Okay, thanks a lot, Director. Our next question is from Manola Morales of KHON2. Governor, or Tim Sakahara, can you specify who is exempt to inter-island quarantine?
Certainly, if you go to the Department of Health's website, there is a list, and on the governor's website, we've posted what essential infrastructure is, and there's a list. It's the same list that was generated by the federal government as part of the overall countrywide focus on stay-at-home and allowing essential infrastructure and essential businesses to proceed, and they will be exempt. We are coming up with a list of the typical jobs and employees that we'll be publishing later on today. We do have a website for those of you who have a question about whether your business or your job is an essential infrastructure business or your job is an essential function. And you can send an email to covidexemption@hawaii.gov, and we will be responding to your questions as quickly as we can.
Okay, Tim, you might want to join the governor up there. This is from Rick Kwan, KITV4. Since last Thursday, how many people total have been self-quarantined? Have there been any problems with compliance?
You know, I think that you've seen some examples on social media of people not complying. We are working with the counties, county police departments all across the state to improve our systems of identifying those who may be in violation of the quarantines and providing the information to the county law enforcement. I don't have a number exactly of those in quarantine.
So the people in quarantine are all the people. The Hawaii Tourism Authority has been sending out daily news releases and updates on how many people and passengers came into the state. So all of the people, with the exception of the flight crews that came into that, are under quarantine. The flight crew and those in transit or those with the layover. The transit or layover people are the ones who arrived in Honolulu or one of the airports here in Hawaii and then are heading out to somewhere else. So they would not be subject to the quarantine. Neither would the flight crew if they are not symptomatic. But everyone else on that list, whether it be the residents, the visitors, or the intended residents, are all subject to quarantine.
Okay, Tim, also this is from Maui News, Colleen Urechi. She asks, can you explain in detail how this mandatory 14-day self-quarantine for inter-island travel will work if and when it's implemented, and what process will people need to go through if they would like to travel between the islands? We also have General Kenneth Howard here with the Hawaii National Emergency Agency, HIEMA, and he'll answer the question.
Hi, good afternoon, and thank you. So, as Governor Ige mentioned, the new executive order will mandate that inter-island travelers will be subjected to the 14-day self-quarantine. The exception to that, or the caveat, is, let's say if you're a healthcare worker and you're allowed to travel, you need to self-quarantine at the place of lodging, then you go and travel to where you need to work or provide your care or services. We're asking that you wear PPE for at least 14 days while you're doing these services. And then upon completion, go back to your place of lodging, and then you'll be subjected to the self-quarantine. Thank you.
Very much. Our next question is for Director Anderson from Big Island Now, Max Bagel. There have been reports on the Big Island that drive-through testing is taking 2 weeks or more to return results. Can you explain why turnaround times are so long, and if there's anything unique about drive-through tests that make their turnaround times slower than other types of testing?
The testing that was done up to recently was all mostly being done on the mainland. Mainland labs are doing the testing, and often they were backlogged for a week or more. So in some cases, it was taking 10 days to get the results back when the samples were sent to the mainland. The local labs are now up to speed on doing the tests here, and I would expect that future testing would be much more see much more quick turnaround times on that. In fact, very likely we'll be seeing turnaround times of a day or so for future testing. The private labs have come up to speed. They are doing most of the testing around the state today and have capacity to do well over 1,000 tests a day collectively. So I expect that temporary situation has been resolved, and we can expect a lot quicker turnaround on any testing locally.
Okay, Director, please stay there. I have another question for you. This is from Eleni Gill with Civil Beat. She asks, we've seen double the number of cases since last Wednesday. How does the department explain this spike?
Well, I think the increase in cases we've seen over the last few days reflects in large part the number of tests that are being done. We're seeing positives on about 2 to 3% of the tests we're doing, and it's simply a question of more tests being done, more individuals being identified that were not previously identified. I don't think it reflects necessarily that the disease is spreading that much that quickly. However, as pointed out, in other locations where we have seen spread, it has occurred almost exponentially. A single individual can infect 2 or 3 other people. If you do the math, you can see that over time that increases rapidly. So we are concerned about the increase. And again, this is the time to take these measures on mitigation very seriously. Keep that social distancing. Don't let down your guard. That's going to make a huge difference in the outcome of what we see here in Hawaii.
Okay, another question, Director, from Rick Kwan, KITV4. What is the criteria or protocol for a person to be considered recovered? Do they require 2 negative tests?
That is being debated across the country, but up till now, 2 negative tests seems to be an appropriate criteria for most hospitals. Obviously, the individual should not be symptomatic, and I believe we had an order of 60 individuals now who have been found to be infectious, discharged from hospitals, and are now, as far as we know, no longer in a situation where they would transmit the disease. So it's a hard call to make, but the physicians are developing criteria for that.
Director, another question. This is from Chelsea Davis with HNN. The Department of Health sent out a warning on Saturday about anti-malarial drugs. Yesterday, the FDA issued an emergency use authorization for those drugs. Who are we supposed to listen to?
I listen to the health department. We have seen side effects associated with those antimalarial drugs. It's possible that they've been improperly used, and certainly I would consult with your physician before you take any medications for treating COVID-19. Even some of the common drugs used to treat the flu have been found only to exacerbate symptoms. Do talk to your physician, get their advice on how to best treat the disease.
Another question from Sandy Oshiro, HPR. Does the state have numbers on how many health workers might be over time be infected? The state said in 2008 that in a pandemic, 25% of its healthcare workers would be infected. Is that still the projection?
Well, we're not seeing that today here in Hawaii, not yet anyway, but they are at high risk, and certainly we're doing everything we can to keep them healthy and on the job. Time will tell to see, as we see this problem evolve. Of course, in New York, you're seeing a situation very different than what we have here, where health workers are often compromised in their ability to protect themselves while they're working. And there, I believe you have seen rates of illness among healthcare workers, most likely COVID-19, about 25%. So we don't want to get there, and we're certainly not seeing that right now in Hawaii. We've had a few healthcare workers that have been exposed and positive, but we're not seeing anything close to 25%.
Also for Director, how many military cases in Hawaii out of the daily total today?
We didn't receive any cases, any reports today. Over the weekend, we did see a couple of cases reports coming in from Tripler. I believe one was a civilian employee, and another case among DOD personnel, but we're seeing a few reports. They are being tracked by the state. We're not doing the same investigations that we do for civilian employees, but the military is following up on all those individuals, and they are being quarantined as necessary.
Okay, another one for you, Dr. Anderson. Anderson, Chelsea Davis, HNN. If there is a death in the hospital and the person had COVID-19 and pre-existing health issues, will the hospital or DOH record it as a death from COVID-19 or the other pre-existing health issues?
If the individual was found to be positive for COVID-19, we would record it and report it as a COVID-19 related death, regardless of what the underlying health conditions might be. We do have a number of people in the hospital as we speak that are COVID-19 and have serious underlying health conditions, and as has been reported in other places, the death rate, the case fatality rate, is about 2 to 3%. Mostly those with older people with underlying health conditions. So I would not be surprised if we saw a death associated with COVID-19 in the not too distant future.
Thank you very much, Dr. Anderson. Lieutenant Governor, did you have something to add there? No? Okay, sorry. The next question is for Tim Sakahara or General Hara. Neighbor Island residents. This is from Colleen Huweshi. Neighbor Island residents are frequent flyers to Oahu for business, health, and family reasons. How are they supposed to deal with the 14-day quarantine when they often only need to go for a day or two? You know.
So we're still looking at that. The bottom line is what we want to do is limit the amount of contact that you have or those individuals have with the public. We're also discussing with some of the companies like HECO as an example when they send out their teams to do maintenance work. Bottom line is I need to get back on that. We're still looking at that. Thank you.
Thank you so much. Governor Ige, a question for you from Audrey McAvoy, AP. University of Hawaii economist Carl Bonham this morning told the House Special Committee on COVID-19 that he expects general fund tax revenues to drop 10% to 20 to 25%. What are you doing to prepare for this decline?
We have been looking at the cash flow for the state. Tax department has been monitoring tax collections on a weekly basis. We've been developing scenarios and identifying ways that we can reduce expenditures on behalf of state government. And we recognize that COVID-19 will have a tremendous impact on the revenues that the state receives. We have reserves that we would have access to. Want to thank the congressional delegation for all of their work. The initial outlines of the direct aid that states and counties will receive will help us weather this period of time. And certainly we are looking at what assistance we get from the federal government to really be able to focus and fill the gaps that may exist. Those in our community who need help that might not be covered in a federal program, we want to make sure that the state and the counties can shape programs that help. We understand that everyone in our community is impacted by COVID-19, and all of us collectively, federal, state, county, want to assure the people of Hawaii that we are working so that everyone can receive the help that they need to make it through this crisis.
Thank you, Governor. Our next question is for Lieutenant Governor Green. This is from Rick Kwan, KITV4. Another shipment of medical supplies is expected today. Did it arrive? And if so, do you know what was in that shipment?
Yeah, thank you. Actually, it came in last night. So a massive shipment came in last night. The team at Healthcare Association of Hawaii, in partnership with our core leadership at General Hara's office, is now going through it. We are rapidly expanding our capacity, and we hope to get PPE out to all the hospitals and get ahead of this a little bit. I know there have been concerns about people not having enough PPE in their hospitals on certain occasions. Especially Maui was concerned, so we want to get everyone, especially all nurses and healthcare providers, PPE.
Okay, stay right there. This is from Wendy Osher, Maui Now. Any best estimate on when Hawaii cases will peak, and how many weeks or months before we see a leveling off?
Well, we may very well be keeping it relatively flat right now, which is the most important thing we can possibly do and hope for. We've asked ourselves many times when we think it will peak. I would say about 3 weeks is a likely timetable, we've been tracking about 2 weeks behind the East Coast, and we're seeing surges all across the country. Just so people know, this is not something new to us. We've always seen surges somewhere between 2 and 6 weeks after the mainland for flu, so this follows that.
Okay, and stay right there. This is a question from Chelsea Davis, HNN. In 2009, she says, hospitals in Hawaii put together an emergency plan which included several stockpiles filled with millions of dollars worth of medical supplies and equipment. Back then, we were told there's enough emergency items to last 8 weeks and enough suits and respirators stockpiled for 50,000 healthcare workers. Is it all gone?
Yes, we've burned through all of the supplies that we had in stockpile, and of course, as you can imagine, 11 years after the previous incident, there's just some breakdown. So when we went through some of the stockpiles, of course, some of it just wasn't sufficient anymore. Some of it had mold on it. We had to make sure we didn't use anything that would hurt our healthcare providers. The good news is we've done and made some very large orders through the General's team. So those orders are now coming in. We've also seen a lot of people, and I should thank them, stepping up and bringing us extra supplies, some of the basic supplies that can help. And then, of course, there's the movement of people out there who are making masks. It's kind of a wartime effort. They're not proven to demonstrate a decrease in spread of germs. However, we understand that everyone wants to contribute. We should ask people to use the N95 masks when they have them in the hospital. That's the best practice.
Okay, and Lieutenant Governor, this question is directed to you as well as to Director Anderson. This is from Lenny Gill, Civil B. Knowing that some young adults are in serious condition on the mainland, how many Hawaii cases have been among adults under 60 years old and over 60 years old?
I think Director will give some information, but let me tell the story of a 37-year-old. There's a 37-year-old who's on a ventilator. Our heart goes out to him and his family. In fact, he's a personal friend of one of my staff. And that just tells you that though our kupuna are more susceptible to dying, on the chart I was able to express that the higher mortality rate does, of course, occur in people who are 75 and older, much higher rates of mortality, 8% between 75 and 80, and a 14.4% mortality rate over 80. But that does not mean people are safe if they're younger. I believe that the majority of the individuals, and I'll defer to the Director of Health, have been more senior, but there is that case, and we do know that one child passed away on the mainland. So nobody is safe. That's why we all have to flatten the curve together.
Dr. Anderson.
I don't have much to add to what the LG said. So far, I believe only 4 of the cases we've seen since this outbreak began were among those under 18 years of age. Clearly, it's a disease that has affected the older individuals in this community a lot more, which is typically what's being seen across the country. As we do more testing, we are finding more middle-aged individuals to be infected, and many of those have less severe symptoms than the older adults do. That's important because they may also be transmitting the disease. So as we do more testing, we're going to probably see more cases among the population. In fact, it may be much more evenly distributed by age group than what we're seeing now, but clearly the most serious cases we've seen have been among the elderly, particularly those with underlying conditions.
Okay, our next question is for Tim Sagahara, but Director Anderson, please stay right there. The question is from Kristen Consilio. Senator Glenn Mackay wants to use Abbott Lab quick tests to improve screening for passengers. Is this feasible and or desirable? If so, what would it take? If not, why? Would that be
Yes, we were informed on the call with the Vice President this morning that Abbott Labs had completed this quick response testing capability. It allows us to get a negative result within 5 minutes, or a positive result within 5 minutes, a negative within 15 minutes. And clearly, point-of-care testing will be a game changer in our communities. Obviously, the most immediate application would be in ICU units where we want to be able to get a test result very quickly. We are in discussions about what we would be able to do with similar point-of-care technology in the airline situation. if we could test everyone on a flight, obviously that would provide assurance to our community that there is no one who is infected on the flight. But we're getting more information about the throughput. Vice President assured us that every state would be getting a number of these Abbott point-of-care test units, and certainly as we receive them, we'll be looking at how we can deploy them in the most appropriate way to ensure the safety and well-being of our community.
Thank you very much, Governor. Does anyone else have anything to add? Okay. Our next question, Dr. Anderson, sorry. Does the fact that none of your surveillance tests have come back positive make you wonder if you're missing cases? This is Chelsea Davis, HNN.
Chelsea, I expect there are cases out there, of course, that we're not seeing through our surveillance testing. Our surveillance testing was targeted at those with flu-like symptoms who didn't have the flu, people who have respiratory illness. So we would have probably seen more positive tests had we expanded the case definition and if we'd done random surveys of the population. That wasn't what this was about. It was simply to get a pulse by taking a random sample of individuals across the state as to whether or not there was a lot of illness circulating in the community. It wasn't intended to be a blanket survey assuring that there was no virus circulating. I expect there has been some localized transmission occurring that we've missed in our survey. Nevertheless, it is a very important tool for us in determining how widespread this illness is in our community, and we'll continue to use that tool. We're getting a lot more results now from the private labs, which is also a very good way of determining how much disease is actually out there. And between the two, I think we get a good feeling for how widespread the disease is. We'll continue to monitor both. Thank you.
From Eleni Gill. How many people have recovered, and what are the quarantine or isolation expectations for those who have recovered?
When an individual has recovered from a hospital visit, they are essentially determined to be free of the disease and would not require any additional quarantine. Could you repeat the first part of that question?
How many recovered?
Yes. So basically, she wants to know how many people have recovered and what are the quarantine or isolation expectations for those who have recovered.
Well, we have, as I mentioned, reports of 204 cases to date of illness. No one's died. So essentially, everyone who we've identified so far has either recovered or is in the process of recovery, at least with the exception of a few individuals who are on in intensive care in the hospitals. That situation is likely to change as we go forward, and hopefully we continue to see most of the cases fully recovered. I might add again that most of the results that we're getting from our sampling surveys are also coming back negative. We have approximately 7. Excuse me if I can check these numbers real quick here. 8,700 laboratory tests have been done, and over 8,500 of those have come back negative, which may be helpful information. Again, we've had only 204 positive tests. Okay.
Our next question is for General Hara. Sandy Oshiro, HPR, asks, what steps is the state taking to deal with arrivals at small boat harbors, which are not monitored 24/7, and will quarantine be required there as well?
So we stood up the State Law Enforcement Coalition. They're taking a look at that problem set. We'll be working with a combination of the county law enforcement and state law enforcement. Okay, thanks.
Thank you very much. Dr. Anderson, sorry about this. You have a follow-up question here. How many people are currently on ventilators for COVID? Any idea? This is from Kristen Concilio.
Yeah, let me ask the LG to talk a little about that. It's likely that only the individuals who are hospitalized are going to be with ventilators, and I believe the number hospitalized is in the order of about 7 at this point in time, but LG might have more up-to-date data.
Yes, thank you for that. So this is an important question overall, too. We believe two people right now, I believe, are on ventilators. Information was just given to me by the team. Important overall. For every about 100 individuals that test positive for COVID across the globe, about 5 people end up needing some pretty serious critical care, and about 1 out of those 100 end up on a ventilator. And that is tracking somewhat similarly to our numbers, and it also helps us to reflect on the numbers we know were tested positive here in our state, and maybe some of the gap where people might not have been tested but are positive and resting at home and recovering. So we can reflect on how much use we're having of our intensive care unit to also see an indicator of how bad the COVID-19 crisis is hitting us. So we not just are measuring, although as Director Anderson pointed out, we now are up to 8,700 tests, most of them out in the community at the hospitals, but also every day we get an update from the Healthcare Association on how many of our hospital beds are used, how many of our intensive care unit beds are used, and how many of our ventilators are used. I'm pointing out one last thing. On the chart, we have 126, I believe, of our ventilators that are being used in the state, but that's because other people are using ventilators because they've had a heart surgery or have had lung problems that are not COVID related. We save as many ventilators as we can, but we still have all of the other health problems that we usually have here in Hawaii.
Thank you, Lieutenant Governor. And we're going to wrap up right now. Governor Ige has some closing remarks.
Thank you so much for joining us here this afternoon. I really wanted to start by thanking the people of Hawaii. I know that each and every one of you have been impacted by this COVID-19 pandemic. I want to assure you and thank our congressional delegation, Senator Schatz, Congressman Case, Senator Hirono, and Congresswoman Gabbard for really working with us to provide a safety net. You know, we are committed to helping each and every family here in the island, each and every business survive the impact of COVID-19 in a way that allows us to come together. We know that it has been in our history for our community to face crisis together and really reach out and help each other. And I have been inspired by the many that I've spoken with, the many acts of kindness and community that I've seen, that I've heard from members in our community. I do know that we are in a critical time and we all must be committed to social distancing for staying in our homes. Stay at home, work at home policy is about keeping our community safe. It is about working together, each of us doing our part to reduce the spread of COVID-19 in our community, bend the curve and flatten the curve so it does not overwhelm our healthcare system, and be together as a community, help each other, and we will be stronger as we work through this COVID-19 pandemic. Thank you very much.